Hello, my name is Tamuno Belema Okojaja. I am a graduate student of Mercer University College of Health Professionals. I will be speaking on domestic violence and black teen women, maternal and child health problem and target audience. Domestic violence, also known as intimate partner violence, includes harm that occurs between intimate partners and between members of families. The range of abuse includes physical violence as well as sexual violence, psychological abuse, and financial control, among others. While violence occurs within the context of romantic relationships, regardless of sexuality, race, or status, there are specific considerations to be highlighted within the population of African Americans. As a result of historical events, African Americans as a whole experience racism, stereotype, and are more likely than other races to not only have a lower socioeconomic status but to also live in poor neighborhoods. These factors combined result to intimate partner violence amongst African American adults, and as such, children who are raised in this household experience violence as an acceptable norm. When the same children becomes adolescents and begins dating, they engage in aggressive behaviors which can range from psychological abuse to physical altercation. The life course stage. Studies consistently find that roughly 50% of children directly exposed to domestic violence between their parents or adult caregivers are under the age of 6. This heightened exposure to domestic violence for young children is consistent with studies showing that domestic violence perpetration and victimization peak for men and women in their late teens and early 20s when they are most likely to have children under 5 years old. The data on early childhood exposure to domestic violence, as well as its consequences for children and teens, affirm the importance of two generation approaches that focus on both the parents and the children to reduce domestic violence and improve outcomes for both generations. This suggests that there may be numerous opportunities to prevent domestic violence through interventions targeting the appropriate contributing factors at the appropriate time. Rationale for selecting problem. Domestic violence occur in dating relationship as well as marriages. As people get married later in life, dating violence will continue to rise. Given the prevalence of domestic violence within these dating relationships and a shift in the structure of relationships today, communities must work together to ensure that victims of dating violence have access to resources such as transitional housing and an increase in legal protection. Existing programs. The intervention or existing program introduced is the introduction of mental health workers who are trained and disciplined to work with trauma and depressed teenagers. This program was introduced in the school as also part of their curriculum to allow for girls to get counseling and education on the concerned topic when needed, which would help build self-efficacy to be aware of necessary resources they can benefit from when faced with similar events in the future. Creation of programs such as poster contests and plays, targets to create awareness in the school on the concerned topic, especially for males, to break that norm of violence is the answer to everything, quote and unquote, which has been found to be effective in first changing the cognitions of teens in terms of healthy relationship and then changing their behavior as well. To augment the existing program, the school can seek to partner with different domestic violence non-profit organizations who are looking to serve these communities by providing them with some resources, further counseling, trainings, and even legal assistance according to their need. It is important to also consider the outcome of unintended pregnancies as one of the root factors to school dropouts for a lot of black teen women. Contextual factors influencing problem and target audience. We will be considering the cultural and societal factors influencing the problem and target audience. The cultural component refers to the values, beliefs, and norms of a society, such as gender roles, marital processes, etc., masculine ideologies associated with physical, sexual, and domestic violence in the overall population. The societal factors are the basic drivers that broadly shape the prevalence and patterns of relationship violence in the general population seen in the target population. These components are unemployment, poverty, gender-based wage inequality, and the concentration of disadvantage within neighborhoods. One well-supported theory that connects these components like poverty to violence in relationships is known as the family stress model, which posits that economic pressure leads to psychological distress and conflict in families that in turn results in violence. One of the societal and or political factors that influence the target population and contribute to the public health problem is the rise in religion healthcare impacting access to family planning services in the United States. This is my reference. I hope you enjoyed my PowerPoint. Thank you.